Hi, my name is Eli Schwartz, and I'm with ElderGuide. ElderGuide is a Medicaid applications company that helps seniors and the disabled apply for Medicaid in the state of New Jersey. And today I would like to talk to you about the Medicaid application process. Before I get started, I'd like to express my thanks to the City of Linden, as well as Aristacare at Delaire, and specifically Sam Schwabel, for putting this together and making it possible. I would also like to make a disclaimer that everything in this presentation is for informational purposes only and should not be taken as legal advice. For all legal advice, an elder attorney should be contacted. I'd like to start with talking about the need for Medicaid. There are currently about 1.4 million nursing home residents across the United States. In New Jersey, that number was about 42,000 as late as 2019. This doesn't account for others that are receiving long-term care, such as in an assisted living or at home. And these numbers will continue to rise due to advances in medicine and because people are living longer. Now, the average annual cost for a nursing home in the state of New Jersey is $135,000. The average stay in a nursing home is 835 days or 27 months. Now, if you were to make the calculation between the cost and the average stay, it would come out that the average cost out of pocket for a nursing home is a whopping $304,000. Now, that is an incredible amount of money. And frankly, how can anyone afford the cost of nursing home care? Even if someone was fortunate enough to have that kind of money in a retirement account and have that as a nest egg, how much of that would be left by the time long-term care is required? So it begs the question, how can we be assured that if the need arises for long-term care, that we will be able to pay for it, or that it will be covered by insurance? Now, there are three main ways to pay for long-term care. Number one, simply, is to pay privately. This means that the senior care provider will charge you monthly, you'll write a check, the check will clear, and you're good to go. But like we just mentioned, the cost of care is so high that this is not an option for most people. Another way that one can pay for long-term care is what's called a long-term care insurance policy, or LTCI. Now, this is exactly as it sounds. It's an insurance policy specifically to cover long-term care. But you'd be surprised to know that only 10% of seniors have such a policy. And the reasons may be, number one, because the cost to purchase such a policy is quite expensive. Number two, the coverage is not absolute, meaning they will not cover in all situations, and it's not for an indefinite amount of time. It may be limited. And number three, not everybody is even eligible to purchase a long-term care policy. In fact, some companies require that an applicant must pass a physical before a policy is issued to them. And that is why only 10% of seniors have a long-term care insurance policy. That being said, now that we know that paying privately is not an option for most people, and a long-term care insurance policy only 10% of people have, what are the rest of us to do? How can we be assured that we will be able to get long-term care and that it will be paid for? Medicaid is a government insurance program. Now, there are a wide variety of Medicaid programs out there, but I'm going to talk specifically about the long-term care program. And this is the Medicaid program that covers the cost of long-term care. Now, there are many requirements to be eligible for Medicaid, but before we get started, I'd like to clear up some confusion that comes up quite frequently with clients of ElderGuide. People will ask us, why do I need Medicaid? Don't I already have Medicare? And the answer is, yes, you do have Medicare, but that will not help you in this situation. And the reason is as follows. While Medicaid and Medicare are similar sounding words, and both of them are insurances provided by the government, that is where the similarity ends. Medicare is a government-sponsored insurance that is available to all residents of the United States over the age of 65 that made the proper contributions. Medicare will cover hospital visits, outpatient doctor visits, and some prescription drugs, if you have a prescription drug plan. It will not, however, cover the cost of long-term care. Even though it will cover short-term rehab stays in the nursing home, those will only last up to a maximum of 100 days if it gets to that point. After that, Medicare will cut, and the cost of nursing home will be the responsibility of the resident. Medicaid, on the other hand, is a government program based on specific eligibility criteria. Not everybody is eligible. But once one is approved, this will even cover the costs of long-term care in a nursing home. And that is why Medicaid is the #1 payer source for long-term care in the United States. So, without further ado, let's get into the specific eligibility requirements for Medicaid. The basic requirements to be eligible for Medicaid are as follows. One must be a United States citizen or a legal alien. Number 2, one must be either over the age of 65 or deemed disabled. If one is deemed disabled, they need not be 65 years old. Now, there are clinical requirements and there are financial requirements. The clinical requirements are as follows. The applicant must need assistance with 3 activities of daily living. Activities of daily living include eating, bathing, using the bathroom, etc. Medicaid will send a nurse to assess the applicant, and if they are deemed clinically eligible, they can now get Medicaid eligibility. Medicaid will send a nurse to meet with the resident and assess their level of clinical need. If they are deemed needy enough, then they can get clinical eligibility. But the most important part of Medicaid eligibility is the financial aspect. And the reason I say that's the most important is not to say that the clinical part doesn't matter. Quite the contrary. It matters a lot. In fact, if someone is not deemed eligible clinically, they can't get Medicaid benefits. The reason that I say the financial eligibility portion is the most important is because that's what takes up the bulk of time and energy in the Medicaid application process. And it includes the notorious 5-year look back into all the finances. Let's talk about the financial eligibility. There are 2 portions that Medicaid will look at as far as the finances go. Number 1 are assets, and number 2 is the income. Now, there are 3 basic scenarios of a Medicaid application, and I would like to talk about all 3 of them, and they are as follows. Number 1, when you have an unmarried applicant applying for Medicaid benefits. Number 2, when you have a couple, meaning both spouses, applying for Medicaid benefits. And number 3, and this is the most complicated of the 3, when one spouse is applying for Medicaid benefits while the other spouse or healthy spouse stays in the community. In the interest of keeping things simple, I'm going to refer to the applicant as the husband and the healthy spouse as the wife, although these roles can be reversed and everything would remain the same. Let us start talking about a single applicant and the financial eligibility process. Like I mentioned, Medicaid looks at both assets and income. So let's start with assets. What is a Medicaid asset? Well, simply, a Medicaid asset is anything that has cash value and is available to the applicant. This could include bank accounts, stock, CDs, retirement accounts, IRAs, the cash value of insurance policies, etc. There are assets that are exempt, and those include the primary home of the applicant, a car, personal belongings, etc. Now, the asset limit in the state of New Jersey is $2,000. What this means is that each month that eligibility is needed and you would like Medicaid to pay for long-term care, the assets across all accounts must not exceed $2,000. If they do, you will not be eligible. Now, I'd like to point out that it's only at the beginning of the month where this is an issue. But let's say someone's applying for Medicaid and they have $1,500 at the beginning of the month. Now, in the middle of the month, they get a Social Security deposit of $1,000, which brings them to $2,500. This will not make them ineligible because at the beginning of the month, they were below the limit of $2,000. But they must make certain that at the end of the month, the money has been spent down again. Okay, now what happens, and this happens quite often with clients of Elder Guide, is when somebody will reach out to us and they'll say, listen, I have about $100,000 in assets, and the nursing home told us that we have to start thinking about Medicaid. What do we do? Well, the answer is that these people are in what's called the spend down phase, where they have to spend down their excess assets before they are eligible for Medicaid. Now, this is an incredibly important part of the application process because Medicaid has specific requirements of how the money can be spent down. And if it's done incorrectly, it can have catastrophic results in the application process. Medicaid has specific requirements of how that money can be spent down. For example, money can be used for personal items. Money can be used to pay off debt or make some home modifications and medical bills. But money cannot be used as a gift. One is not allowed to gift money to someone else. This is what is known as a disqualifying transfer, or a transfer of assets for below market value. If one was to engage in this, it would result in a penalty period, and this is how it would work. Medicaid is going to conduct a thorough review of 5 years of financials. They're going to see if there were any disqualifying transfers made, such as gifts, or a sale of a home for below market value. Medicaid is going to calculate that number to come up with one lump sum. They're going to take that number and divide it by what's called the Medicaid penalty divisor. The penalty divisor is the average daily cost of a nursing home in the state of New Jersey. That number is currently $357.67. So, for example, if let's say Medicaid conducts a review and they determine that $15,000 were made of disqualifying transfers, they will do $15,000 divided by $357.67, which will come out to a 29-day period of ineligibility. This ineligibility period is going to begin the date that Medicaid benefits were denied. Once the Medicaid penalty period is over, the patient will now be covered by Medicaid. However, during the penalty period, there will not be a payer source. At least Medicaid won't be that payer source. So it's incredibly important that one do the spend down properly so as not to result in a penalty period. This covers assets. Now let's talk about income. First of all, what is income? Well, simply put, income is any income that the applicant receives. This can be employment, pension, Social Security, stock dividends, etc. Now, before we get to the Medicaid income limit, let me talk about who gets the income and who receives the income. Medicaid will require that the income go to the facility or the care provider, and Medicaid will cover the difference in cost. So, for example, if John is applying for Medicaid benefits, but he receives an income of $2,000, and the facility is reimbursed by Medicaid generally $7,000, Medicaid will only pay out $5,000, and John will be responsible for the other $2,000. However, Medicaid does allow for some of the income to go elsewhere, and that is as follows. In a nursing home, an applicant is entitled to $50 a month in P&A money or a personal needs account. This will come from the income. One is also entitled to keep all of their health insurance policies, and this can also be paid out of income. A spousal allowance, which we're going to talk about in the next portion of this presentation, is also paid out of the applicant's income. The remainder of the income is paid to the facility. Now, this is all going to be calculated at the end of the application process by the Medicaid caseworker, and they will determine how much income will be due to the facility and how much can be kept by the applicant. Now, the Medicaid income limit in the state of New Jersey is $2,382. Now, you might be thinking to yourself, wait a minute. If I make more than $2,382, which is, quite common between pension and Social Security, then I won't get Medicaid benefits? but the cost of a nursing home is about $12,000 a month. So what am I to do? The answer is you're going to establish a qualified income trust, or what I'm going to refer to as a QIT. A QIT is a trust account that Medicaid requires be established and funded each month that eligibility is needed. Now, the rules of a QIT are as follows. It must be an irrevocable trust. The beneficiary upon death must be the state, and it must be funded properly each month. And there are also specific places that the money can go. Now, the way this works is that any money deposited into the qualified income trust is not counted as income for Medicaid purposes. So, for example, let's talk about John again. He's applying for Medicaid. He has $1,000 in Social Security and $1,500 in a pension. His income is $2,500, which is above the income limit of $2,382. John will set up a qualified income trust, and he can either fund it with all of his money or a portion of his money. Any money deposited into the qualified income trust is not counted as income. So John decides he wants to deposit his Social Security income of $1,000. So now Medicaid will deduct $1,000 from his income, thus it will bring it down to only $1,500. Hence, he will be Medicaid eligible. It's important to note that one must fund the qualified income trust with either all the income or a full source of income. Meaning, John would be required to pay either $1,000 or the $1,500 pension. John cannot, for example, take $500 and fund the QIT because Medicaid requires that a full source of income be deposited. Okay, now what could the qualified income trust be used to pay for? First of all, it can be used to pay for the personal needs allowance of $50 in a nursing home. It can also be used to pay the facility or the applicant's cost share, which is the amount of money the applicant is required to pay along with Medicaid. Like I mentioned earlier, the qualified income trust should not be used as a regular checking account. So this covers income and assets of a single applicant, and I'd like to recap that quickly. Income. The income limit for a single applicant is $2,382. If the income exceeds that amount, a qualified income trust would have to be established and funded properly each month. By doing this, it would bring his income back under the income limit, thus rendering him eligible for Medicaid. Assets. The asset limit is $2,000. The assets must be under $2,000 at the first moment of each month. Any excess funds would need to be spent down according to the Medicaid guidelines. Okay, now let's move on to a case where both spouses are applying. Now there's not that much to add here as it is quite similar to a single applicant. One big difference is that the assets of both spouses cannot exceed $3,000. You might have thought that being that there are two applicants, each would be eligible to keep $2,000, but when both spouses are applying, that's not the case. With that said, I would like to move on to the case of where one spouse is applying and the other spouse remains in the community. And like I said, I will refer to the applicant as the husband and the non-applicant as the wife. Now, there are two main differences between a spousal case and a regular case. One is that in a spousal case, Medicaid will require the documentation on both the husband and the wife, such as a birth certificate, Social Security card, bank statements, etc. Number two, the financial review will be done on both of them. And the biggest difference is what is known as the impoverishment rules. This is the money that Medicaid allows the healthy spouse or wife to keep in the community. Medicaid will allow her to keep a portion of the assets, and in some cases, a portion of the husband's income. Now let's start with the assets and how that works. There's a program called the Community Spouse Resource Allowance, which allows the spouse in the community, the wife, to keep a portion of the assets. The rule is as follows. The community spouse can keep half of the assets, a minimum of $26,076, up to a maximum of $130,380. Now the way it works is as follows. Medicaid will take a snapshot of all of the assets at the time of admission to the hospital or the nursing home and split it in half. So let's say, for example, when the husband went to the nursing home, there were $40,000 in assets. So let's do the math. 40,000 divided by 2, or split in half, is 20,000. So we're going to allocate $20,000 to the community spouse and $20,000 to the spend down. But wait, the husband is still entitled to his $2,000. So we're going to take $2,000 from the spend down and give that to the husband. So right now, the wife has $20,000, the husband has $2,000. But as I mentioned earlier, Medicaid allows the wife to have a minimum of $26,076. So what we're going to do is we're going to redirect the money from the spend down and give it to the community spouse. So we're going to give the community spouse $6,076 from the spend down to bring her up to the minimum of $26,076. The final breakdown will be as follows. The community spouse will have $26,076. The applicant would be left with $2,000, and that would leave $11,924 to be spent down. Let's take a simpler case, for example. Let's say when the husband entered the nursing home, there were $100,000 in joint assets. $100,000 split in half is $50,000 to the wife and $50,000 to be spent down. But $2,000 will remain with the applicant. So in this case, the wife will get $50,000, the applicant will get $2,000, and the spend down will get $48,000. And in this case, there's no need to redirect any of the spend down funds to the wife because the $50,000 is more than the minimum that she is entitled to. Now let's talk about one last case. Let's talk about a case where when the husband went into the nursing home, there were $500,000 in joint assets. Now $500,000 split in half is $250,000. So $250,000 to the wife, $2,000 to the husband in the nursing home. That would leave $248,000 to be spent down. But wait, the wife's portion exceeds the limit that Medicaid allows of $130,380. So we are going to redirect the excess money from the spouse and put it toward the spend down. And the final breakdown will be as follows. The spouse gets to keep $130,380, which is her maximum. The applicant and the husband gets $2,000. And in this case, $367,620 would need to be spent down. This covers the community spouse resource allowance. Now let's talk about income and how income works in a spousal case. Medicaid also has impoverishment rules in place to ensure that the wife and community spouse will be allowed to retain some of the income. And those rules are as follows. Medicaid allows the spouse to keep up to have an income of $2,155 or a maximum of $3,259.50. Now let me explain exactly what that means. Let's say, for example, John goes to the nursing home and his wife, Mary, only has $2,000 in income. Medicaid will allow Mary to take $155 of income from the husband to bring her income up to $2,155, which is the Medicaid minimum of what the spouse is allowed. This is what is called a spousal allowance. Now, there are certain times based on the community spouse's expenses, her home expenses, her mortgage, and her utility bills, that number, that allowance can increase to $3,259.50. Whatever the allowance is would determine how much money can be reallocated from the husband to the spouse. Now, this is what is called as the minimum monthly maintenance needs allowance or spousal allowance. So that basically covers the impoverishment rules of what the community spouse gets when the husband is going to a nursing home. Now let's just recap quickly. Assets. Assets are split in half, and half will go to the community spouse. She is entitled to a minimum of $26,076 and a maximum of $130,380. And we went through each case before with all the specifics of how it would work. Income. The community spouse and wife is entitled to a minimum income of $2,155. If the income is not that amount, we can redirect income from the husband and give it to the wife. For example, if the wife only had $2,000, we would take $155 from the husband and give it to the wife. It's important to note that money that is taken from the husband and given to the wife will not reduce his income in terms of a qualified income trust. Meaning, if the husband's income was above $2,382, and a qualified income trust would need to be established, even if money is redirected to the wife, which would bring his income below that threshold, a qualified income trust would still need to be established and funded properly. From there, the money would be given to the wife. But a qualified income trust definitely would need to be established. This concludes the financials of a Medicaid application for both a single applicant, when a spouse is applying, and when one half of a spouse is applying. I would like to conclude this presentation with what I refer to as Medicaid pitfalls and what to avoid when applying, and they're in no particular order. I just thought you would find this helpful if you will be applying for Medicaid in the near future. Number one, the reality as a senior is that life is even more unpredictable than for all of us. Things can happen in the blink of an eye. God forbid someone can fall, and before you know it, nursing home care is necessary. And that's why I advise that everyone try and appoint a power of attorney. Especially when it comes to the Medicaid application process, I see that when someone doesn't have a power of attorney, it can cause a tremendous amount of heartache and headache. Being that many documents must be signed, and a lot of financial transactions have to be done in order to achieve eligibility, in a case where the applicant is incompetent and there's no power of attorney, it makes it very difficult. Number two, I'd like to talk about what I refer to as hidden assets, or assets that one may not see at first glance. Like we said earlier, the assets may not exceed $2,000 at the beginning of each month. Now, one might go through all his bank accounts, his stock and everything, and say, oh, everything is spent down, I'm under $2,000. But sometimes one may forget about a life insurance policy or a funeral trust. A life insurance policy, many of them have cash value, and Medicaid considers the cash value of a life insurance policy as a liquid asset. So if someone is under assets in their bank account and they only have $1,500, if they have a life insurance policy of $1,000, that's going to bring them over the asset limit and deem them ineligible. This could cause months of ineligibility and thousands of dollars of loss because it's not always necessarily easy to catch this. And the same goes for a funeral trust. One might have heard that one is allowed to have a funeral trust, but the only funeral trust that's allowed is if it's irrevocable. A revocable funeral trust would also be considered a cash asset and can ruin eligibility for the applicant. Number three, it is incredibly important that throughout the application process and even through the months of eligibility, that the applicant is on top of all bank accounts to make sure that they remain under $2,000 at the beginning of each month. Now, especially when someone goes into a nursing home, this is very important because many people in a nursing home have a personal needs account where $50 get added each month. After a few months, this could accumulate to a few $100s. And if this doesn't have an I kept on it, this can put someone over the asset limit of $2,000, deeming them ineligible. And finally, I'd like to talk about a qualified income trust that has to be funded properly each month. Like I said earlier, the qualified income trust must be funded with a full source of income. Now, one may look at their bank statements and see that their Social Security check is $1,500, and they'll say, okay, great, let me fund the QIT with $1,500. But what they don't realize is often that's the net amount after deductions for taxes and maybe health insurance premiums. Medicaid actually requires that the gross amount be deposited into the qualified income trust to fund it properly. If the net amount is deposited, that is not called funded properly, and it may result in ineligibility. So it's very important that the correct research is done to determine what the gross amounts of the income are that are funding the qualified income trust. This concludes my presentation on the Medicaid application process. Again, I would like to thank the City of Linden and Aristacare of Delaire for making this possible. And if anyone has any questions, they can feel free to reach out to Elder Guide at 908-212-1691. Again, that's 908-212-1691. Or you can email Elder Guide at info@elderguide.net. Thank you, and I hope you found this to be helpful.